Hi, I'm Professor Igor Rudan from the University of Edinburgh, and I will tell you a little bit today about the mHealth approach to monitoring and evaluation of global health programs through the Planet tool that together we developed, Professor Devi Sridhar and myself here at the University of Edinburgh. So, what we learned over the years from most of those who tried to develop some evaluations of large-scale health programs in global health, and we know that there are many of them going on all over the world. We learned that when you're doing those evaluations after the programs have already been rolled out, it becomes incredibly difficult to do this, because firstly, in those areas with scarce resources when the programs were being rolled out, there's hardly ever been any time to document every single thing that was happening and to keep the documentation in check, especially over the long periods of time. Even if at the start that was a genuine intent, usually over a period of time it just kind of waned down. So it's very difficult to conduct those evaluations, because even then, if you just want to speak to people who were involved in those programs at the end of the program, you realize that those people probably moved on after the program has finished to some other source of income, and they're doing something else, and it's very difficult to trace them. So evaluating programs has been extremely difficult, and many of those evaluations, although that should be a very important part of the program, have not really been done that well, or people who were conducting evaluations complained themselves how it was difficult for them to do this. So how can we deal with this problem? What could we do to help evaluating the program, but without making it more onerous on the people who are actually involved in program conduction? Well, we thought of a way to do this through something which we called Planet, the Planning, Monitoring and Evaluation tool, which we revealed a few years ago in the Journal of Global Health. This is the concept. So, based on our understanding from the implementation of the Chunru method of how crowdsourcing can be a powerful and simple tool to gather a lot of useful information, we started thinking of how programs are actually deployed. And we realized that there are three levels of people who are important as a source of information within various programs. The first one is funders, the second one is managers, and the third one are the recipients of the program. So these are the donors, these are the implementers, and these are the end users. And let's see what is yellow in this slide. The yellow is money. So money flows from almost as being some sort of an energy which is supposed to change things for better, right? So you can think of money here as some sort of an energy which is changing things for better over the implementation of the program. And you have the total annual global economic output with profits and taxes, and then you have publicly or privately raised funds which can go into various programs. So those are your funders here: bilateral donors, multilateral donors, which are operating by giving away tax money, or industry donors, or philanthropists and NGOs as donors, or any combination, or some even funds that are a combination of private and public donors. So you will have some funder of a program, and what factors are important to consider here? There are some external contextual factors for funders, such as global economic outlook, tax rates, proportion of the budget assigned to development assistance for health, okay? And also tax waivers, interest rates, budget deficits, regularity in contributions, new finance mechanisms, and so on. So that's all things to consider at the level of funders. At the level of managers, well, the external factors are government support, national level priorities, internal academic regulations, attitude to private sector in the country, and so on. And then finally, at the level of recipients, external contextual factors can be community participation, inequity in a population, social capital, corruption index, media, and their stance, data availability, education, security, safety, political stability. All important external factors to consider. Okay? Now, what did we identify as important when you get from the money from whoever is the donor to a total annual development assistance for health? Clearly, we identified that the managers who are important are the recipients of those funds as a first-hand recipients. National level ministries of health and development, academic institutions in high and low and middle income countries, private sector contractors and consulting companies, international organization country offices such as WHO and UNICEF's, non-governmental organizations and other not-for-profit agencies. These are all the players at this level, right, who could be the first-hand recipient. And then you distribute development assistance for health, and you have the second level recipients, which could be still national level governmental health systems and UN country offices, non-governmental organizations, not-for-profit agencies, private healthcare providers, related industries and contractors, representatives of the local communities such as political or religious leaders, and specific groups of recipients such as mothers, children, disabled and chronic patients. And finally, what this does is it has an impact on the total burden of disease and disability, and not just on that, but also on the total amount of the missed health potential. So not only that you can be reducing the burden of disease and disability, but you can be also reducing the total amount for missed health potential and improving the development potential of people. So this is how the funds flow through programs if they're based on development assistance for health. Okay? So what would we want to know once a program starts rolling? What would we want to know? And what would we want to check regularly, maybe every month or 2 months or 6 months even? But what would we want to know is happening with the program? Let's see. At the level of funders, we were thinking on this in terms of some sort of like Chenery method-like criteria. What 5 questions should we ask to know what's going on with this stage, or at this stage? Firstly, what would you like to ask the funders themselves? Well, is it likely that the amount of financial investment may not be proportional to the size of the problems that are being addressed? That's the first concern we could think about, which they should be thinking of. Second, is it likely that the investment may be driven largely by the interest of the donors, such as their national security or other agendas, rather than the real needs of the recipients in the recipient countries? Thirdly, is it likely that the investment may have been approved without full knowledge of similar investments from other donors? So the question of coordination between donors and lack of this. Is it likely that the investment may create even more funding mechanisms rather than using the existing ones? Because everyone who wants to make a big investment usually likes to also take credit and think it as nothing ever happened before, and make it a big new thing. However, we know that there are already existing mechanisms of funding established, and maybe it is better to use those than every time whoever wants to invest creating a new financial mechanism. And then, is the investment likely to spend too much of its total budget on some middlemen, bureaucracy in the high income world? This is what we see happening quite a lot. You're trying to help and get the money into the low and middle income country, but then on the path of this money, so many of these middlemen, consultants from high-income countries come and try to take their share of that money for their already quite well-off companies, right? So those are some things to be asking yourself if you are a donor in development assistance for health. What if you are a manager? What if you're an implementer? What should you be worried about? What would you like to know from the managers of the program? Firstly, is it likely that the desired effect of the investment will be reduced through corruption and stealing of resources, as they are being deployed in low and middle income country? We would like to be having some idea and information about what they think corruption may be like as the project is rolled. Is it likely that the desired effect of the investment will be reduced through incompetently managed allocation? So corruption is the first question, incompetence is the second. Are you aware, or do you think that just the wrong people are being put in the wrong positions of responsibility, not the best people? Is it likely that the desired effect of the investment will be reduced due to poor evidence to support decisions? So, do you think that you just have no idea what you're doing, basically, and you don't have any evidence to help you decide what to do? Is it likely the desired effect of the investment will be reduced due to an unnecessary preference of non-governmental organization over government? This is yet another important factor to consider. Are you just arbitrarily relying on NGOs because they're NGOs and you think that's a good idea, rather than trying to empower the government and support its structures? Is it better perhaps to actually use the government channels and try to consolidate them and improve them? And finally, is it likely that the desired effect of the investment will be reduced due to unnecessary exclusion of local expertise? Again, maybe, with the development assistance of health, we would really like to build capacity locally and give more chance to local people to become better at what they do, and not always just be paying for people to come from the outside and do the work. So those are very important things that we thought we should be considering as the programs are being rolled, and asking people what do they think about each one of them, so that we can see what is the prevalent opinion of the funders, of the managers, on the existence of these problems, and how does that opinion change over time. So two things are important here. Not only to get some assessment for each program at the start from the funders and the managers about these questions, and get the signal from them where they already anticipate there's going to be some problems, but also what's even more interesting is how over the course of the program, how do those opinions change? And sometimes they're going to be frustrated how people from the outside who should be helping are not there enough, and then they will increasingly become frustrated with this, or corruption may not be a problem at the start, but as the program rolls in, people may start signaling, we worried that there's corruption here. Finally, the last level of recipients, what are the key questions here? Is it likely that the desired effect of the investment will be reduced through corruption and stealing again? So even at the recipient level, you could be stealing somehow the aid. And this is interesting. Is it likely that the investment may unnecessarily create parallel local implementation structures? You already have some implementation structures everywhere, and we want to enhance them and strengthen them, not create even more structures that are not working. Is it likely that the investment may not be well aligned with local priorities or fail to involve local communities? This is one thing which we need to know. Is this aid imposed on the people without actually taking into account what they really think is the need in their community? And or is it well aligned, and have they been asked about what their needs are? Is it likely that the investment may seem unethical, inequitable, in any other way unacceptable to recipients? So do you have the problem with this aid and its acceptability? And finally, is it likely that the desired effect of the investment will be reduced for the lack of adequately trained human resources? So are we simply not equipped with sufficient human capital and resources to be able to even deliver this promises of this program to the community? So those are the 5 important criteria we could think about at the level of recipients. Of course, every program is going to be different. So just like with Chunri, people should feel welcome to add further criteria or to change the existing criteria. It is completely fine, and keep the numbers to 5, maybe reduce it to 3, maybe expand it to 10, add more, change the existing ones, just like Chunri. So what do you do then, now that you familiarize various actors at 3 levels with these questions, you basically start collecting their input by a simple set of 5 questions. You send them on mobile phone every month or so, or every 2 months. And in this way, you're actually monitoring and evaluating all the things that seem of, not all, but quite a few things that seem of importance that could go wrongly. And you just compare how the trends in their responses change over time, okay? And basically, little by little, you get to the point where you realize whether the enthusiasm about this program in various aspects at various levels went up, or was it stagnant, or did it go down and dried out over the course of the program. Now, what would be really interesting is if we could do this at the same time, in a real time, for many programs all over the world, and have a central data science kind of platform to collect this stuff, because that would allow us to see whether there are some similarities and some patterns that are in common to all programs that are being rolled in low and middle income countries, because maybe we would be able to detect by analyzing a lot of input from many places that there are just some typical things that happen, you know, corruption, incompetence, misalignment with priorities, change in acceptability, maybe everything good at the start, and then how things little by little start falling apart as the program continues, or not, or maybe we would be very pleasantly surprised, and in fact things would start with a skepticism, but then we could demonstrate that actually everything is getting better. So that is Planet, and I think it could be a very simple and very useful tool, again not costing much, but creating and generating a lot of useful information for us who are trying to then monitor and evaluate what's actually happened. So thank you very much for your attention. Thanks.